now experiencing higher numbers of disease, and I was answering the question previously about Russia. I'd forgotten to say that there've nearly been about 450,000 tests carried out in Russia, which just puts it about, when you do it for the number of tests per million population, is around 30,000 per million, which of the 57 countries in the European region of WHO puts Russia about the 10th highest of all the rates of testing. The positivity rate is about 3.6%, which again is quite low compared to the positivity rates in other countries. So in that sense, just to follow up on the previous question, the number of deaths also remains very low as a proportion of the overall cases for the Russian Federation. So, but you see that, you can clearly see that the number of cases has risen in somewhere like Russia. What we have to be very careful of is that the death toll doesn't rise with those cases. The other factors around the world, I was speaking the European context there, so many other factors driving the risk of transmission in countries. The degree of compliance with public health and social measures, the availability of effective public health response like contact tracing. We've seen countries who've been very systematic with a very comprehensive strategy. I think of countries like New Zealand who've really done the lot, and they've gone from public health measures to a very graded response to very systematic case finding and contact tracing to a high rate of testing. When all of those factors have been put together, the disease tends to be more controllable. So disease epidemiology is driven by the natural history of the virus, it's driven by human behavior, and it's obviously affected by the public health or the health response to the virus. So it's very hard to make hard and fast rules for what happens in any individual country. Maria?
Thanks. I just want to touch upon one aspect of this. The virus is transmitted through the respiratory route. It's transmitted through infectious droplets from an infected person to another individual who's in close proximity to that person without wearing protective gear, or through contaminated surfaces where you touch a contaminated surface and you inoculate yourself through touching of your eyes or your nose or your mouth. The parameter that we look at to really evaluate how fast and how quickly this virus could spread is called the reproduction number. And that number is the average number one infected person individual will infect. If that number is above 1, then the virus can take off and you can have an epidemic. If that reproduction number is below 1, it will die out. And so what we're looking at in a number of countries is that they're constantly evaluating is what is the reproduction number, and they call that the time varying reproduction number. That number is context specific, as Mike was saying. If you prevent people from coming in contact with one another, if you isolate known contacts so that they don't have the opportunity to be in contact with someone else, if you find the contacts and you quarantine those contacts, and they do become cases, they don't have the opportunity to infect other people. You actually break the chain of transmission, and the virus has nowhere to go. The virus needs a person to be able to transmit to another person. If we are able to break those chains of transmission, we can bring that reproduction number under 1. And it's very context specific. Even I brought up Singapore before, but even thinking of what's happening in Singapore, they were able to bring their outbreak under control until the virus had an opportunity to start in a closed setting where you have people who are living in close contact with one another. These types of closed settings exist in all countries, in long-term care living facilities, in institutions, in prisons, and we need to find ways in which we can prevent the virus from transmitting from one person to another. And that way we can bring that reproduction number under 1, and we can break those chains of transmission. This is the first pandemic in history that we can control by doing these measures. Find, isolate, test, treat, find all of the contacts, quarantine those contacts, engage your populations, have them know what they can do to protect themselves and protect others.
Thank you very much. So we will conclude, and I apologize to journalists whose questions have not been answered this time, but obviously we will have other opportunities. the audio file will be sent in the next hour or two, and transcript will be available tomorrow. I wish you a very nice weekend to all.
Yeah, thank you, Tariq. Thank you for joining us all online, and have a nice weekend.